Okay, hi. So today I've been home for about 24 hours now. It's my fourth day post-op. Like I say, been home 24 hours. When I left the hospital, when I was in the hospital, I felt like, I've got the pain. The pain was pretty much easy to handle. Didn't require pain medications that often. But after being discharged and after coming home, I realized that the pain was like on a different level. I guess being more mobile. Sorry, the lights are going on and off. I guess we're having a power outage. Sorry about the lights. But anyway, so the pain, I guess with being more mobile, it's increased pain. So I'm finding that I need to have pain medication pretty much every 4 hours. I'm trying to do that just so I don't have any breakthrough pain. I am getting up more, going to the to the bathroom more frequently, and just trying to be a little bit more active, but not too much, because the more I walk, the more pain I get into. Pretty much, as long as I have the pain medication, I find that I'm able to pretty much, get around and walk with no issues. So anyway, so today my blood pressure is a little bit elevated, on the elevated side, but that's to be expected. The doctor said, initially it's going to be a little bit more on the elevated side, but it's still within the range that they're not too concerned about. But I got up this morning, weighed myself, no changes there, nothing drastic, because I want to make sure you weigh yourself, make sure you're not retaining fluid, and make sure that you're excreting fluid. So weight wise it's constant, blood pressure is not too bad, pain level it's around a 4 to maybe a 6 once the pain medication wears off. But everything's okay. As far as my husband, he has like about 4 incisions compared to my 1, so I think the pain for him is just a little bit more intense. But we have lots of help here and we're holding it down. So I was hoping not to have to venture outside of the house until maybe an additional day, but it turns out I have an appointment with the doctors tomorrow. So tomorrow's the 5th day post-op, and I'm going to have to make my way there just to have some labs drawn. So I'm going to have that done. So anyway, that's just my 4th day post-op update. I will try and just update every day for at least the first week or so, just to show my progress. But that's it for now. Talk to you later. Bye. Hi again. So today is 5 days post-op, and as you can see, I'm back in hospital garb. Today was my scheduled day to have my labs drawn at the transplant clinic. I went there in the morning and then went home. Within about an hour of returning home, I got a call from the clinic to say that my creatinine levels had increased and that they had wanted me to come back to the hospital and get a biopsy of the kidney, just to make sure that rejection isn't an issue. I did have and had some diarrhea since the surgery. It could be because of the medications that I'm taking. It does cause that. So dehydration with the diarrhea could be a cause for the increase in creatinine. Hopefully that's the case, but if it's not, I don't really feel like I'm dehydrated. They going ahead and running some tests on the kidney to make sure that early rejection isn't an issue. It does happen quite often where rejection can happen in the early stages, and with their monitoring of the labs, it does help them to identify and treat rejection in its early stages and turn it around and prevent it from happening. So with the biopsy, I'm to stay in for a day or two. Hopefully tomorrow afternoon I'll find out the results of the biopsy to see if it's that. If it is a rejection, then they'll have to do some more treatment, and which will cause me to stay in a bit longer. If it's not that, then there's chances I get to go home tomorrow. With that also, I had the biopsy. I had to lay flat for 4 hours post that. That period is over with now. Okay. So the biopsy itself wasn't bad, but because the area around the kidney is still sore, that made it a little bit uncomfortable. Anyway, they gave local anesthesia, lidocaine, and actually performed the biopsy in my room. On bed rest for 4 hours. That's now over with. They also gave me some more prednisone, like 600 milligrams. I'm not sure if I'm going to sleep tonight. That was given IV, and just my regular my other medication. So anyway, that's all. I just wanted to give you an update for day 5 post-op. I will check in with you guys again tomorrow. I was readmitted to the hospital yesterday. My creatinine levels rose. They said it looks like it could be possible early rejection. It happens sometimes, so the decision was to take a biopsy and treat with high doses of prednisone. I had that done yesterday. I had 600 milligrams of prednisone yesterday. Had the biopsy done yesterday. Got the results today. I haven't got the full results, I don't think, but the doctor had seen it and said that it looks like it was like a minor rejection. So the action plan is to go ahead and give me a few more high doses of prednisone today and possibly tomorrow, IV, and just continue to watch, and I come back in the clinic and get my levels drawn. It's funny because with the high dose of prednisone, it seems like, because prednisone is anti-inflammatory, so I think that's also helped my pain level, because being in here, my pain isn't so high since being in here, which is good, but I'm sure eventually when they kind of reduce it, the pain, well, maybe the pain might not increase again, because it's going to naturally subside eventually anyway. So anyway, I guess that's an upside of the steroids, if there is any. But yeah, so that's it. It's possible I might get discharged today, have the additional steroid dose as an outpatient tomorrow, but the doctor's going to go downstairs and look at that biopsy, discuss it a little bit further, and decide after that. So that's pretty much it. Today's been uneventful apart from that. Kind of getting restless, ready to go home, but at the same time I know that this is the best place right now. So anyway, hopefully be home between today and tomorrow. So that's just an update for post-op day 6. I will chat to you guys tomorrow. Bye. Okay. So this is
Hey ladies, how are you all doing?
Post-op. Anyway, I was discharged from hospital yesterday, and now I'm having IV, prednisone, steroids right now as outpatient. So yeah, today is Thursday, and I had surgery Thursday, so I guess it's
Yes, that's what I'm asking. Do you think it's
7 days post-op? Okay. Sorry, forgive me, I'm tired. So anyway, this is my outpatient IV preparation. It only takes 30 minutes, so won't be here too long. Talk to you later.